Hi, it's John at C Nation, and you are tuned into the Kush Journals. Join me and my occasional guests each weekday as we discuss all things cannabis in the great state of Utah. Hi, it's John at C Nation, and you are tuned into the Kush Journals. Hey, we have a real treat for you today. I sat down with Guy Setton, CEO of GemmaCert, while we were at the Terpenes and Testing World Conference, and had a really great chat with him about their cannabis analyzer. Here's that interview. I'm with Guy Setton, the Chief Executive of GemmaCert, and I'm here to tell you this is one of the coolest products I've ever seen. We came to this convention to look at their product and to talk to them a little bit, and actually I think I spent 3 hours in front of their product last night in a little bit of an after-party suite they hosted, and we tested some cannabis that had some labels, that didn't have some labels, and we found some interesting results. And primarily, we found a lot of mislabeled labels. What is up with THCA being misrepresented like this?
Well, I mean, the mislabeling in the industry is quite well documented. There's actually a study which was conducted by Johns Hopkins University a couple of years ago, along with the University of Pennsylvania, which showed that over 80% of the products on the market in the cannabis industry are mislabeled. And part of it has to do with poor analytical regime, and the other side has to do with it is a misunderstanding of, as you mentioned, between THCA and THC.
Is it all labeled data, or is it primarily the THC, because that seems to be the marketing draw to cannabis?
The market, as you correctly mentioned, the marketing drives mainly THC, but obviously, particularly from medical perspectives, there are people out there who need to know as well the CBD potency. So it applies also to CBD.
We're even seeing incorrect label data on CBD.
Yeah, but the main thing right now is in terms of the market really has to do with THC. What the user should really have available to them, beyond obviously knowing that the product is safe and free of pesticides, etc., is that is the total THC figure. Okay, because in the flower, in the dry flower, most of the THC found there is actually in its precursor format, which is THCA in its acidic form. And only when the product is heated up does the THCA convert into THC. And there is an equation which enables you to accurately estimate the total THC, which is the realistic amount of THC which a user will be exposed to when they consume the product. And that is, you take your THCA content plus there is still, in a dry flower, there's still some THC already there, but it's really a little amount. So
the THC delta 9.
Yeah, so you take the THCA plus the THC, and you multiply all that times 0.877, and that number, the number you get there, is much, much more realistic as to what will be the real THC content that you'll be exposed to.
So why doesn't THCA convert 100% to delta 9?
I don't want to go into the chemistry there, but there is product lost along the way when it's heated up.
So it's got a low boiling point.
So it's not 1-to-1, and that's why there is some loss there.
Is it worse with a flame compared to like a ceramic vaporizer? Is that roughly that 877?
It's an 877.
Okay. I actually saw your product work firsthand last night. In fact, I think I hogged the room. We saw something really interesting. The result that the GemmaCert analyzer provided was roughly that 100% number. When we ran the math against the number that was on the label data and compared it to the results generated by GemmaCert, it was really statistically what's the right here word here? It was that THC number 8.7. It was that. It roughly wound up being that down to the 100th. Point that is statistically irrelevant. Yeah. So it is interesting to see the labeling data like that. And do you think it's ignorance, or do you think it's intentional, or do you think it's in between?
It's probably in between because, I mean, we cannot deny the fact that product is priced higher for higher potency.
True.
And there are, in different markets, different points where the price can jump 20-30% because it's above a certain THC potency.
Well, and they seem to have a little hedge on this because the labeling data almost always says from state to state plus or minus 15% accuracy. Yeah. That's an incredible way.
It's an incredible range. And by the way, that range or that fluctuation is the exact reason why there's a challenge for the medical community to recommend cannabis for whatever health conditions are out there, because there is no ability to guarantee the dosage, and doctors are constantly what they're trained for is to provide exact dosage for their patients, and this is the exact opposite of what they know what to do. And actually, on a side note, if you go back and read history on cannabis, I mean, cannabis, the golden age of cannabis in the medical community was in the second half of the 19th century.
Okay.
When it was widely used across the United States and Europe. And something happened at the end of the 19th century where the medical community abandoned cannabis. And if you go back and you read what happened, doctors were constantly complaining that they don't know how to recommend cannabis because the variation is so immense. Right. What was the knockout blow for cannabis at the time was Bayer came out with aspirin. And the minute you had aspirin, which you knew, the doctors knew every time it was a fixed dose, right. It made their life much easier. And they had the confidence to recommend different treatments to their patients, non-cannabis-based treatments. And today, you have that same problem again. So a lot of the problems the industry is facing today are problems the industry faced over 100 years ago. We're not inventing the wheel all over.
Right.
And so I think there is naivety out there, but there's also a shrewd, I don't know how you want to call it, business decision that because people are not aware exactly what goes on in the plant itself, that whatever we put on the label gets across. But I think for the user, if they go into a dispensary and they buy a product, and just before they buy the product, they can, every smartphone today has a calculator.
Right.
Take that number, multiply times 0.877, and see if it's what you're looking for or not. Because that is more likely to be accurate than what's on the label, if you don't have the means, obviously, to test it yourself.
Right. Well, I like this line, this train of thought right now, and I'm going to stick with it real quickly. And if you don't have a solid answer on it, doesn't matter, okay. Neither here nor there. It's been said a lot that cannabis was always meant to be a medicinal product and not an intoxicant. People generally will root that in the fact that the potency of cannabis today, primarily THC, has risen over the years. And if we talk about cannabis a century ago, it would not have been anywhere near these levels of THC. Is that correct?
Put it this way. I think that if you would do a thorough study of really what's out there on the market, then you would see that the average is much closer to what it's been over history. Yeah. It's true that there are varieties out there with very high THC content, unlike what was available before. Some of it is also questionable whether it's really, if it's really that's the content of the flowers or the flowers are adulterated in one way or another. But even assuming that there are very high, above 30% THC flowers out there, I still think it's on the margins of the industry when you look at the industry as a whole. And so I think that the average potency of cannabis available today is probably not that far away than what it was throughout history.
That's interesting. We know that obviously, they're going to tout these big high numbers because 30%, well, because there will always be college freshmen, right?
But, you also have to think, if 30% THC or 40% THC right. of the dry weight of the flower, it also doesn't make sense. The flower, weighs something, and you don't have THC in that weight in the flower. So there's some problems there as well.
Just in general, the molecules just won't concentrate.
Exactly.
That's very interesting. One of the things about your product that I really liked, and I'd like you to just say why this is really a differentiator for you, is that it preserves the actual flower. I mean, I saw it. A good-sized bud. It's put in the chamber, and that's that. And when the testing is done, guess what? There it is.
Yeah. I think if you look today at all the devices and solutions that are on the market, they are solutions where they came out of the analytical world, out of the professional lab, and professional labs are based on testing individual specimens, individual samples, and providing results. And when you use spectrometry, for example, which is now more and more commonly used in the cannabis industry, as it has already been used and recognized by the FDA for online on-site QA/QC in the pharma and food industries, even spectrometry, if you apply it on its own, only tests a particular part of the flower.
Okay.
And therefore, the solutions which are available in the market based on spectrometry, in order to overcome the heterogeneous nature of the flower, the fact that the trichomes are not spread equally over the flower, they ask you to grind the flower.
Interesting.
And so we knew when we were going to go and develop our product, we knew that we wanted to avoid having to prepare any sample and obviously destroy any sample. And while spectrometry provided a good, affordable solution, we needed to add something onto it in order to avoid that, overcome that challenge. And that's where image analysis comes into play. Basically, we've made the spectrometer much smarter, and we know how today, through image analysis, how to scan entire areas of the flower, not just one particular scan.
Yeah, it's like a three-phase. There's three separate components of that really
it's basically it's a moving spectrometer. And here I go back to where I started, was that we developed a product with the supply chain in mind, with the patient in mind, with the doctor in mind, and not the lab. Okay, and while the lab is interested in one particular flower, the supply chain is interested in the batch.
Right.
And the batch, you need to know the average of the batch. And so when you need to test 10, 15 flowers from a batch to get an average, then you want something that's easy to use, quick, and obviously you don't want to be destroying that number of flowers.
Right.
So that's why we've gone down that path of spectrometry and image analysis.
Well, we've seen the product. I love it. I really do like it. It's it's a small countertop thing. It looks like a cookie jar, to be quite honest. I like the design quite a bit. I view it as a cost-effective item. Do you see this like in a doctor's office, in his office? Do you see this with a grower? Do you see this with the parents at home that are helping dose their children? All of the above?
I think it's today it's all of the above.
Okay.
Okay. I think my vision for the longer term, when you walk into a supermarket and you buy any product, you don't go test the product. You trust the brand, you trust the label. Obviously, every number of years there's some scandal out there and some mislabeling in the food industry, but 99% of the time it's right. And I think that eventually, hopefully, one day the cannabis industry will be like that as well. And so our technology will only be used by the professionals, from the doctors all the way through to the growers, but that the consumer will have trust in what they're getting.
So if they want to claim they have 30% THC, they'll either have to raise that or stop making the claims,
exactly. Right?
Because it'll be GemmaCert certified. That'll be the label on the packaging.
But in today's uncertainty in the market, with regulatory uncertainty or naiveness about the science and everything, lack of trust in the labels, then the device is really applicable to everyone on the supply chain.
Awesome. Do you have plans for different versions, different types, larger, smaller, personal, carry type, big whole room size stuff?
Well, we obviously have a plan, part of it already under development, for additional analytical capabilities for the existing device. Some of it will be prioritized based on feedback we get in the market, but we're talking about additional cannabinoids, additional terpenes, moisture, possibly also mold. We do see eventually this industry, it's inevitable that there will be consolidation on the grow side.
Sure.
There will be large players and economies of scale will come into play. And like every agricultural sector, or product. When it goes mainstream, you need automated lines. And we believe that our technology can be applied to automatically sort flowers on conveyor belts.
And still preserve them?
Yeah, of course.
Nice.
So it wouldn't be one sensor, it would be a number of sensors.
Right.
It would be a larger system, but it would enable the facility to scan the flowers in real time and start sending them off to different directions based on preset criteria.
Sounds like the Postal Service does.
Yeah.
sorting letters by zip code.
Exactly.
Well, Guy, that's really all I have. I really like your product a lot. I saw it in action. It worked like a charm. Some product we had wasn't labeled, but we suspected it was here or there, and we could see the marketing hype. There was no question about it. To your point, you're in a dispensary with labeled THCA, multiply it by 0.877, and that's probably what you're really buying.
Exactly.
Thank you very much.
Thank you very much.
We did a recap of our convention time at the Terpenes and Testing World Conference, and we have a little bit more discussion about GemmaCert and its products and the time that we were able to spend with them. Though the interview audio is identical from podcast to podcast, we want to let you know that there's a little more discussion over there, and this same interview can be heard in that podcast. For everyone at C Nation, this is C Nation John. Thanks, and have a great day. Kush Journals is a copyrighted broadcast of the South American Gold Corporation. We appreciate your likes and shares on social media, including Facebook, Twitter, and Instagram.